Good morning, everybody. This is Betsy Wurzel, host of Chatting with Betsy and Passionate World Talk Radio. Jeannie White is the producer. Today I am going to talk about the healthcare industry. I should say the medical care system in this country is broken. Unfortunately, folks, I don't have an answer. I wish I did. I'm going to talk about the topics I have discussed with doctors these past few months and my own experience. And people might think, Betsy, don't you have anything pleasant to talk about on your show? Well, folks, I talk about reality and the realities of caregiving, the realities of life itself. And one of the realities is the healthcare system in this country is in trouble. It's broken. And this is doctors that are saying this. And it is not a Republican or Democrat issue or party problem. It's a human being problem. Because whether you're Republican, Democrat, Independent, even if you're a socialist, libertarian, you need health insurance. You're going to end up needing to go to a hospital or a doctor for something sometime in your life. So this is an issue and a problem for everybody. And what I want to talk about is there's going to be a severe shortage of doctors. And I even read an article about this a while back. People are not going to be going into medicine because they can't practice like they like to. Why can't they practice like they like to? Because, excuse me, the insurance companies and the government, such as Medicare, dictate to doctors what they can and cannot do. And it is causing doctors more stress. They spend more time fighting with the insurance companies. My endocrinologist told me, Betsy, the insurance companies are bullies. They bully us. They tell us what we can and cannot do. The people who are telling doctors what they can and cannot do are not even medical professionals. My cardiologist that I just went to, he told me that he called up an insurance company and they called him a healthcare provider. He said, Betsy, they didn't refer to me as a doctor. He said, I'm not in the business. I'm here to take care of people. I am a doctor, and if you're not going to call me a doctor, then I'm not talking to you, is what he told the insurance company. I remember, folks, back in, I'm going to say, the early 90s, when HMOs, maybe the late 80s, when HMOs were starting. And Matt had changed jobs, and I had to be in an HMO, and, of course, you had to get a referral. And there was a lot of discussion going on that, doctors who didn't refer patients had received bonuses from the insurance companies. So they were encouraged not to refer their patients to specialists or for tests. And folks, whether people want to admit it or not, the insurances are making big-time money, and it is a money. It's all about the money. And it's not the doctors making the money. It's the insurance companies. So don't think that I'm against health insurance. I am not. And God bless the doctors in this country. We need them. But the insurance companies are making their lives miserable. And then they will leave the practice. And we won't have any doctors. Or there won't be enough, and the wait to see a doctor will be very long. Folks, I can tell you personally of the discussions that I had with doctors in my visits. The hospice doctor, that was a hospice doctor in the hospital, has his own practice, he told me. He told me it's 15 minutes. 15 minutes, folks, to cover many issues with his patients, and he can't get it all done in 15 minutes. He said I have to cover talking about end-of-life issues when people reach a certain age, and some people have no clue. And I told him that on my show, Chatting with Betsy, and in my group, Kick Alzheimer's Ass Movement, I have talked about end-of-life issues and telling people you need to be prepared. Start thinking about end-of-life. Start thinking about how you want your end-of-life to be. Talk about it with your loved one. How do they want their end-of-life to be? It needs to be discussed, folks. And he said to me, that's good that you're talking about that, because if people listen to you, it will make my job easier. So we have to discuss these unpleasant topics and subjects because they are part of life, whether we like it or not, whether we want to deal with it or not. My, Matt's primary doctor told me that his sister was a social worker for the hospice company that Matt had, and his sister left because she saw changes. What is going on, folks, and I don't know about anywhere else in the country, I'm going to talk about New Jersey, that's where I live. You have hospital systems buying up other hospitals, and they're becoming a monopoly. And according to doctors' opinions, it's not really for the better. It's making things worse. And it's going to be a problem. It's just, I'm speechless sometimes, folks, when I do a show, because sometimes I can't put into words the reality of how things are. One doctor told me, the hospice doctor, in fact, said to me, they have to meet criteria, certain criteria, to have a patient admitted up in a hospice unit for Medicare to get to be reimbursed by Medicare. And they don't follow the protocol, they won't be reimbursed. And even if they do follow the criteria and Medicare decides, oh, you didn't, they take away the reimbursement. Can you imagine that? And if someone who is discharged and they're on Medicare and they go back to the hospital for the same exact problem, Medicare has a problem with that. The hospital gets penalized. They may not even reimburse the hospital. And these are, it's going to be, it's a problem. And with aging baby boomers, such as myself, I'm 62. I'm a baby boomer. People that need to be in placements in facilities, Medicare doesn't pay for nursing homes. They're going to be going on Medicaid. It's going to drain the Medicaid system. And what are people going to do? And listeners, like I said, I don't have the answers, but I don't think it's right that people get divorced to protect their assets, for their spouses to get help. They have gotten divorced, but they still live with their spouse, but they only got divorced because they needed to get their spouse help and to protect assets. That's sad, folks. That is really sad. A coworker told me when she lived in Indiana, there was a family, their child had cancer. They lost their home because of the treatment. This shouldn't happen, folks. This shouldn't happen, that you lose your home. You have a loved one needs to be in a facility. You lose your savings. You lose everything. It's not right. There was a time that of a person had to be placed, that the spouse was kicked out of the home and had to sell the home. Now they let the spouse live in the home. It wasn't that nice. It is really a travesty. And in, New Jersey, I call it the so-called affordable health care plan because it's not affordable. I'm on it. I can tell you it's not affordable. New Jersey's affordable health care plan isn't based on the true model for whatever reason. And I don't even know which governor screwed that up. I really don't. I don't remember. We have 3 insurance companies to choose from. They're all expensive. I had the lesser of the 3 evils, I call it. And it's expensive. I had to get a CAT scan of my lungs. Out of pocket, $227. I had to go for an MRI of my shoulder. Out of pocket, $315. Plus $50 for specialist. You can go broke going for tests and trying to take care of yourself. And I was spoiled when with Matt's former company, I paid 10%. And when Matt turned 65, his employer, he was already on disability, his employer said, we cannot cover you anymore. You're on your own. So I had to get the so-called Affordable Health Care Act. Josh was okay, my son, because he was already on Medicare and Medicaid. Matt at the time was okay because he was on Medicare, and I just had to find a supplement for him. It's really difficult, folks. Doctors are spending more time finding insurance companies during doing the bureaucratic red tape bullcrap, fighting for patients, why they need a medication, fighting for approval for tests. This is tying up the doctor's valuable time. One doctor told me, neurologist, he said, yeah, the insurance companies are making profit because they keep denying patients medicines, treatment. Patients who have been on medications for years, insurance companies are now saying you can't take that. We want documentation. And so the doctor provides documentation and more documentation and has to spend that valuable time fighting with the insurance companies. I can tell you from my own experience, Matt never took the Exelon pills. He took the patches. When he switched to the Medicare Part D, and then he switched to, he was on, I don't know if I could say the name, but he was on Express Scripts, and then he went to the ARP, Walgreens plan, and I was told, oh, yes, he could, be able to take that, but you just had to provide documentation. Well, the doctor provided documentation, and they denied it. I wanted it at a reduced tier because I paid, and this was 2 years ago, $177 for 30 patches. Excuse me. And that's a lot of money, folks, until Matt would have reached the deductible. So I fought it. I appealed it again. And thankfully, I won, and they reduced it. Then I paid $5 for Matt's patches. So insurance companies don't think people will fight or ask for appeals. And folks, you have to fight. You have to fight and ask for appeals, because if your loved one needs a medication, then you have to do that. And it's sad that people have to choose between their medication and paying a bill or eating. I talked to a nurse one time, a nurse manager at the insurance company, and she said, well, people, they have problems because they're not taking their insulin correctly or the diabetic medications. I said, well, did you ever think that maybe they can't afford to take it, and that it's not that they're not complying with the doctors or the doctor's order, but they just can't afford it? Did that ever occur to you? And she said, you're right. I said, people are at the point, and some people, whether you choose, do I pay my light bill or do I pay my medication? I know my boss. He's on medication, and he told me that he can't afford it. He doesn't take it like he's supposed to. That's a shame, folks. It's really a shame that people cannot take their medications. And then they get complications because they can't take their medication. And then what happens? They could end up going to the hospital to be treated for that when it was preventable. It's a real mess, folks. It just is. Doctors have 15 minutes to go over many issues with a patient. And patients have questions. And yes, you should ask your doctor questions. Be prepared when you go to a doctor for a doctor's visit. It just isn't right. And also, I told my cardiologist this. I said, do you know that there is different criteria for someone to be on hospice that is cancer versus someone with dementia? He didn't know that. And I said, yes, there is. A person with cancer can talk. Someone with dementia, if they say more than a certain amount of words, they can be denied hospice. And I was told this by the home hospice nurse. She asked me if Matt talked, and I said, when he was being evaluated for hospice, I said, yes, sometimes he does talk. She said, I'll pretend I didn't hear that so he could be admitted. And then during the course of the month, when the home nurse came to visit, she heard Matt. He would babble, and then he would talk clearly. And she said, does he talk? And I said, yes, sometimes he does. She goes, well, if I hear him talk more than 6 words, he can't be on hospice. And I said, yeah, so I heard. I said, so you mean to tell me someone who is end stage of life, could hardly move, incontinent, needs help eating, needs help with everything, is going to be denied hospice because they could utter some words? That's not right. Not right at all. So the doctor's hands are tied, is what they have told me. They can't practice the way they were taught. They can't go by their instinct. They either have to under-test or over-test for fear of getting sued. It is just, I don't know what you would call it, folks. It's crazy in this day and age. Now, I know that, America has the best doctors, and people from other countries come over here. And, there are difficulties in other countries with universal health care, what they have. It's not perfect there either. And their hospitals, I heard, are terrible. You actually have to care for your own family. And some of these hospitals in these overseas. So, what is the solution? I don't know. People, I think, I used to tell this to Matt, that they're going to end up doing euthanasia on baby boomers because they won't be able to afford us because there's so many of us. Now, some people have no problem with physician-assisted suicide, and they will move to the states that had that. New Jersey was supposed to get that, but it was stopped. Now, folks, I'm not here to debate morally whether that's right or wrong. Let me put it this way. I understand why people would choose that. I really do. I personally cannot do it. I personally could not do that to my loved one, but I understand why somebody would choose that. I'm not here to judge. That's not my job. I am having Josh go to a lawyer this summer. Josh is going to be 36 in July, and I want him to do a living will. I don't want to have to make decisions for him. I want him to make a living will and to decide what does he want at his end of life, even though he's only going to be 36. Folks, we're not guaranteed the next breath. We're not guaranteed good health. We all need to think about this. I don't even care if you're 18. Start thinking about what you want your end of life to be like and go to a lawyer and get a living will made. And pick someone that you trust that would carry it out. I'm glad that we did that. Matt did that. Folks, it's hard. It's hard to decide, do you want a feeding tube? Do you not want a feeding tube? Do you want to be on life support? But these are things that are not pleasant, but we have to discuss. And way back, I think in the 90s, doctors were getting kickbacks from pharmaceutical companies. And doctors would push certain medications, and they'd get nice vacations, and they'd get, perks, as you would call it. I don't know if that still happens now, but some doctors will give you samples. Ask for samples before you spend a lot of money on prescriptions. My older brother had stents put in, and his doctor wanted him to take some kind of a pill that was $600. He said, I can't afford that. I can't afford it. Is there something else? And they told him to take a baby aspirin. You have to tell the doctor, I can't afford this medication. Or you're going to have to fight with your insurance company. Or go to these discount drug companies, I don't know if they're drug companies or pharmaceuticals that you see online, which for the life of me I can't think of right now, but it's almost 1:30 in the morning as I'm doing this show. There's different ones online where you could, pay cash, but it's at a discounted rate. It is a hot mess is all I have to say. I went to a support group. My first day was yesterday, my bereavement group. And even there, the people said the healthcare system is broken, and it's about the money. Folks, if anyone's listening to this who wants to come on, talk about your experience, if you're a doctor, you work for an insurance company, you want to be anonymous, that's fine. Contact me. Tell me you want to come on my show and discuss your side of the story. You know, I don't fault doctors because they want to get paid and they have to follow the protocol. I understand that. And, you know, I almost feel sorry for doctors because of the bureaucratic crap that they had to put up with. And folks, malpractice insurance for doctors is astronomical. I remember my GYN doctor, and this is probably at least 5 or 6 years ago, told me just to walk into the hospital, his malpractice insurance was $42,000 a year, and he was at the lower end. The doctors were paying more. People, how are doctors going to afford paying astronomical malpractice insurance? This is insane. But that's the way it is. And you're seeing a lot of GYN, OBGYNs giving up practicing because they can't afford it. I have a cousin. He was a GYN doctor, an obstetrician, and he left to be a teacher because he could not afford the malpractice insurance and all the other crap that he had to put up with. And he probably retired from that in the 90s. And it's really a sad state of affairs. But I had to come on and what I call spill my guts about this. You know, for doctors to go through all that training, and it's very expensive, their medical school, and what they go through, and then not to be able to practice how you like, and to have to fight the systems, it's just not right. And people are gonna be thinking twice before going into a medicine now. And the patients are the ones who are going to suffer. There's a waiting now, and it's only going to get worse because I did read there is going to be a shortage of doctors. And I think what they might do is to offer incentives to people to be a doctor. You know, maybe give them scholarships or cut some kind of deal that they work in some kind of rural or urban area, and maybe they'll pay for a part of their schooling. This is what it's going to come down to. Folks, you need to be an advocate for yourself and for your loved one. I say this all the time. You need to speak up. If you feel something's not right, then you need to seek peace about it and get another opinion. There's nothing wrong with getting another opinion, and any good doctor would not be insulted if you wanted a second opinion. And talking about medical insurance and, the cost, my mom took an early retirement, and her company still, carries her. She pays part of it. She has very good insurance. My mother had open heart surgery in September. She's also Medicare. And she didn't pay anything yet. If I should happen to need shoulder surgery, which I can't afford, I have to pay 20%. 20%. I can't afford that, folks. I hope and pray I don't ever need surgery, and I don't get sick because I just can't afford it. I'm not the only one. So this is my topic for today, or I should say it was my topic. And let me know what you think. Write in your opinion. You can tell the radio station. If you want to come on and talk with me, send me a note. You can follow me on my Facebook page, Betsy Wurzel, Wurzel. And, of course, excuse me, I have my support group, #Kick Alzheimer's Ass Movement. If you want to be educated about Alzheimer's or other dementias, if you want to be inspired, if you are a caregiver, even if you are not a caregiver, we have people who are not caregivers, you can join our group. It's a great, supportive, loving group, if I have to say so myself. And this is Betsy Wurzel, host of Chatting with Betsy, Passionate World Talk Radio. I want to encourage you all to do preventive health care, to be your own advocate, and to love yourself enough to take care of yourself, whether you're a caregiver or not. And I have to tell you this one story, folks, before I go off. Speaking of preventive health care, colonoscopy is supposed to be 100%, right? Because it's routine, it's preventive. Well, with my insurance company, I was told, and they remove a polyp, they see a polyp and remove one in a colonoscopy, then it's considered surgery, and I would have to pay 20%. I said to the person, are you kidding me? That's the purpose of going for a colonoscopy, to see if there are polyps. And if there are, they, of course, will remove them. This doesn't make any sense. Really, it does not. Now, with my private insurance I had before, they paid colonoscopies 100%, even with getting polyps removed, which I don't believe I had any. Can't remember, actually. It's been more than 10 years. So I am due to go, and I'm planning on going this summer. But I feel, folks, that nobody should have to go broke and get to the point of being destitute or have to divorce their spouse to get medical help, to get assistance, to protect your assets. Something needs to be done. And if you have any solutions, feel free to come on and chat with me. You can reach me through Passion World Talk Radio or my Facebook page. And I want everyone to just give yourself a hug and say, I am loved and I'm worthy to be loved, and I am going to take care of myself, even though it's sometimes hard. So goodbye, folks. Till I talk again, this is Betsy Wurzel. Have a great day. Bye-bye.